One tool that people can take home and use right away from my presentation is using customers themselves to help you in gathering data. I'm going to be talking later this afternoon about decreasing patient visit turnaround time in a primary care office, so that's something within the healthcare industry. And when we were looking at our turnaround time from check-in to check-out during the patient visit, unfortunately we were only able to pull that overall piece from our electronic data. So what we did is we put together this very simple patient note card. It includes on here, this is a very early draft of it, check-in, time going into the exam room, what time did the provider come into the exam room, and what time did you check out. We gave this to patients themselves upon check-in, had them walk through their visit, fill it out as they went, and we were able to get so much more data through using this tool rather than what we were just able to pull out of the electronic health record, which was only the time they checked in and the time we checked out. This helped us to look more closely at what process they're going through, where do they spend the majority of their time waiting it. A lot of it is in the waiting room before they even get called back. A lot of it is sitting in the exam room before the provider even comes in to talk with the patient. We have used this tool at a couple other practices, and we have added a couple things to this note card. We added what time was your actual patient appointment scheduled for. So if a patient's supposed to come at 2 o'clock and they come at 1:30, maybe they're waiting for 30 minutes. Is that our fault or their fault? Maybe we need to do some education around what time we expect them to show up. And then we have also added a row to this on what time did your medical assistant finish with you in the exam room and then leave the room, because that breaks out the time even more from when, okay, someone has left the room, you're now sitting in the exam room by yourself waiting for the next care provider to come in, and that's a very specific segment of time that we want to try to decrease while you're sitting there waiting. This is something you can do even outside of the healthcare industry. If you're having problems with getting data out of your electronic systems, use your customers themselves. Give them a note card to fill out and have them walk through the process and collect that data for you. The majority of patients will fill it out. We know the data is not perfect. Maybe they don't have a watch on, they can use their smartphone, different things like that. But for the most part, we believe that the data is very reliable. I think we only had one patient who said, I don't want to fill out information on a study without being paid. This wasn't a paid study, so that was kind of an interesting response. You know, this isn't a research assignment, this is just a process improvement that we were doing. But other than that, yeah, every patient has been more than happy to fill this out, because it also sends a message to them that we're focusing on this, we're trying to improve your wait time and your turnaround time, and that's something that they value. And then we can continue to use this tool over time. Once we make some changes to the process, we can immediately see through using these patient note cards how quickly did those turnaround times come down after making those changes.